Hello, cruel, cruel world. What is bipolar affective disorder, previously known as manic depression? What have some of Kanye West's recent behavioural issues been, and could they be related to his diagnosis of bipolar affective disorder? What are the general kind of effects that this disorder might have on relationships? I will answer all of these questions and many, many more on this episode. So the reason I wanted to make this episode is because I did something very similar on my homeboy Sean Atwood's channel recently. Shout out to Sean. And because I love you guys like my own children, well, at least like a kind of distant niece or nephew, I wanted to bring the material here. So let's get started. So bipolar affective disorder, I think, is something that's commonly misunderstood or misquoted, I should say. So people who just have mood swings sometimes describe themselves or other people like that as bipolar, but that's not the case. In fact, I've done a whole separate video on bipolar versus mood swings, and I'll put the link down in the video. Bipolar disorder is a severe mental illness, and it's characterized by three different periods. There's depression, we'll understand depression, low mood, lack of interest, lack of pleasure, lack of sleep, lack of energy. And then there's periods of mania. Mania is like the opposite of depression. So when somebody's in a manic phase, they're full of energy, full of ideas, they feel really creative, they talk really quickly. But the problem is they don't really finish anything and they act impulsively. So they might be, for example, sexually promiscuous, they might make impulsive purchases, they might do or say things that are out of character for them. And then in retrospect, when they're better, then they often regret some of their actions and decisions. Excuse me. And the third period is euthymia, which is in between. That's normal mood, as in stay euthymic. So bipolar affective disorder is a tendency to go between those three phases. They last between days, usually weeks at a time, and that can be curtailed with medication. So mood stabilizers will kind of decrease those peaks and troughs. So that in a nutshell is what bipolar is. What's Kanye been up to recently? So from what I've read, he's been a bit erratic, I think is fair to say. So he is not happy about splitting up from Kim Kardashian and her new partner, the comedian Pete Davidson. Kanye has been making sort of direct and indirect threats towards him, threats to hurt him. He's kind of tried to engage his own fans to potentially hurt Pete Davidson. So is that related to bipolar? Well, the answer is this. It could be. It could be. So when somebody is in a manic phase, they certainly can act impulsively and they can act in a disinhibited manner. So they don't have the usual inhibitions of usual social norms, morality, etc. However, I would argue that in this particular case, I don't think that it is bipolar, and I'll explain why. Because it's quite in keeping with Kanye's personality. You know, he's very outlandish. He says, even when he's well, he says controversial things. He says things that most people will kind of raise their eyebrows at. So I think this is just him being a little bit threatening, arguably creepy, a bit maybe selfish and not thinking through the consequences of his actions. We do know that Kanye has been diagnosed with bipolar in 2016. And we also know, according to Kim, that at times he's not been taking his medication. I don't know whether that's the case right now, but those I suppose would be counter arguments of why it could potentially be bipolar, even though overall I don't think it is. That makes sense. Another interesting aspect that I think is almost unique to Kanye is this. Compared to most other people who suffer with this disorder, he is a superstar rapper, and he surrounds himself with yes men and people that kiss his ass. Why is that significant? Why am I mentioning this? I think this sets him up in a situation where he doesn't receive enough critical feedback. So people around him are always calling him a genius, telling him everything he's doing is acceptable and is absolutely fine. Even though the press might criticize him, I'm talking about the people he keeps in his social circle. So I think because he's in this kind of environment, he's not being told that he needs to calm his behavior down. Say if like Jeff from Accounts did exactly those things, a lot of people in his work, maybe his partner, would be telling him to calm down, but Kanye is just being Kanye. One other thing I wanted to say, this is not really directly related to his mental illness, but I just think it's an interesting point, is I saw that documentary Genius recently on Netflix, and I have to say that it made me kind of think about Kanye in a slightly different way, in that I didn't realize how much of a struggle he had. So for him to break through as a rapper, even though he was an established producer, nobody really believed in him. Even when he got signed to Rockefeller Records, people weren't really feeling him. They weren't giving him any attention. And the reason I'm bringing this all up is because I think it really, he had to be so well motivated. He had to put in so much effort to get his music heard time after time after time after time after time. And again, he was rejected. So when he eventually broke through, and the same music that he was being ignored for, the same music was the one that later became his album, A Late Registration, and won him all those Grammys. So he's had that talent, he's had that music, you know, in his back pocket the entire time, but nobody took him seriously. It took years. So I think that's added to his sense of entitlement and his sense of grandiosity. Because he struggled so much, he now thinks, finally, that I've made it. I've put in so much work and effort. This is part of the thinking that makes him so narcissistic, so egotistical, I think. Okay, enough about Kanye. My last bit is I want to talk about the effect that bipolar affective disorder can have on relationships. Well, the first thing is that, sorry, I'm answering this question because somebody asked me on one of the YouTube comments. The first thing, I guess, is it depends on whether the partner knows that the individual has bipolar, right? So as I said, bipolar is characterized by periods of going in depression. So obviously that would have an impact on a relationship if somebody's not as responsive, if they're not as fun, outgoing, low in mood, low in energy. That's going to affect their functioning in the relationship. Conversely, if somebody's manic a lot of the time, then they might be doing things that are quite impulsive. That might be quite fun to be in a relationship with somebody with those character traits to a degree. But once it gets past that, once the person's doing things that are impulsive, like spending, I don't know, money from the joint account, possibly even sleeping around, that's not impossible to imagine for somebody who's in a manic phase that wouldn't do that when they're euthymic. So those things can really rock a relationship, I imagine. By the way, I'm talking theoretically, and I'm talking here from patients that I've assessed in my career as a psychiatrist. I imagine at least some of the people watching this either have bipolar or know people, or might even be in a relationship with people with bipolar. So I would love to know what your experiences and your thoughts are. Let me know in the schmomment below. One other last thing I want to say, and then I'll leave you to your day, is that being in a relationship can actually be quite helpful for somebody to contain their bipolar affective disorder. And that's because even though when people go into depression, they usually have insight, so they're usually aware. The opposite is true for mania. When people become manic, they feel good in themselves, right? You don't want to stop feeling good, but they might not recognize their, impulsiveness, irritability, their disinhibited behavior. So a lack of insight is what I'm talking about, and that's a classic sign of bipolar. It's also a sign of psychosis, but that's a different topic. So if you trust somebody really, really well, say if you're in a loving relationship, your partner, your wife, your husband, you might be able to use them as a way of gaining insight. So if you trust them 100% that they tell you when you're becoming more unwell, then that's a way of recognizing that you're deteriorating. So that's when you know to go see your doctor to increase your meds, possibly if it's really bad to go into hospital. So that's another way that relationships could be a protective factor for bipolar affective disorder. Okay. Let's keep it moving. I ain't got no time for shucking and jiving. Just before I go, I implore you please to subscribe to this channel, A Psych for Sore Minds. I dissect a whole range of topics to do with mental illness and offending. If you're interested in mental illnesses, hence watching this video, you should check out my recent videos on autism, whether it's being overdiagnosed and the dangers of that, including some case examples of famous people with autism. I've done one on schizophrenia, what it is and what it isn't. I've done one on personality disorders, what they are, and separately, whether it is unreasonable to label somebody with a personality disorder and how that can potentially be harmful. I implore you to subscribe. Not only does it help me out immeasurably, but it actually improves your halitosis. We both know you've been struggling with this. Right, that's enough from me. Stay euthymic, and whatever happens, do not forget to buy my book, but also that I love you. Bye.